I usually would say for patients that are struggling with weight, we base it on the BMI, which is a ratio of your height to your weight. Generally, when your BMI hits 35, is when patients qualify for surgery. But for a patient to know their BMI is at 35 is different than saying, well, you're overweight. So I say when people hit about that 75 to 100 pound overweight level, that's when they need to start considering. Or if they've failed multiple diets and exercise programs, that's when they really need to consider a surgical option. So there's no magic number that I would say, but most people know when it's time. In the first consultation, we'll do a history and physical. We'll talk about their options for weight loss. We'll discuss the 3 procedures that we do, and we'll decide, both myself and the patient, which one we feel is the best for them. Most of the time we come to an agreement. Sometimes they may want to go with a simpler procedure such as a lap band, despite what our recommendation may be, but either way, it's a process that we talk through, and we make sure that their family is involved too, because again, it's a lifelong decision that we help them make, and with their family support, I think that makes it a little bit easier for them as well. So that's in the first consultation after the physical, we'll demonstrate what we do. We'll show them the device if they choose for a lap band, and by the end of that day, they'll have a better feeling of what the process is, and they're usually a lot less nervous about it. Most patients are nervous about surgery in general. When it comes to their weight, that's a very big decision, because all of these procedures are a lifelong process. Some of them are permanent, where they're not reversible. Some of them require lifelong follow-up. So I think that it's a big step for patients to consider when it's something that a lot of people can manage with diet and exercise. I think it's important for them to realize that obesity is a disease, and it's not something that's just going to go away. So we educate them extensively on what we do, how the process is going to work. We offer monthly support groups as well, and we just keep them informed every step of the way of what's going on, and just have very close follow-up with them. The patient care post-op that's involved is monthly or bi-monthly visits for wound checks, for if it's a lap band for their adjustment, also the nutrition counseling, which is, in my opinion, almost more important than the surgery itself. We also offer the support groups monthly, and we have exercise programs set up for them as well. So it's not just do the surgery and send them away. The success to bariatric surgery is in the follow-up. So we see our patients several times a year, almost monthly.